Welcome to my video presentation for Professional Communications for the Physical Therapist Assistant for my PTA course 104 in Miss Professor Suggett's class. This is Sumi, she is my patient for the night, and this is my mother, and she's going to be the learning clinician that I will be demonstrating, and she will be re-demonstrating to me on proper mobility techniques of supine to side lying, and then from supine to sitting on the edge of the bed. Next, we're going to go over proper body mechanics. To start off proper body mechanics, you're going to want to keep your back straight. To keep your back straight, you're going to want to bend your knees and your hip like so. This will make sure that your back is straight and it evenly distributes the weight throughout your body. Secondly, you want to keep a wide base of support. Wide base of support is going to be your feet spread shoulder width apart, slightly about an inch or two wider, to ensure a wide base of support. Anything narrow is going to make you able to topple over and not be able to regain your balance if you need to quickly. Thirdly, you're going to want to create a tight core muscle. To make this tight, you're going to want to contract your abdomen along with your lower back muscles. To do so, you're going to contract like you're going to be about to do a sit-up. To do this, it ensures the lower back stress is not overdue to throughout your lower back, but also creates a more controlled environment for you to be able to grab the patient and give them support if they do start toppling over or falling over. Fourthly, you're going to want to lift with your legs. Lifting with your legs ensures that your lower back and your upper part of your body isn't strained from all the excess weight from whatever you are lifting. It puts it into your quad muscles, which are your largest muscles in your body, to be able to support that weight. Lastly, when you are using the weight in your arms, you do not want to twist without moving your feet. Twisting without moving your feet will hurt your lower back. Will put strain on your lower back and throw out a disc possibly. So if you do want to move with weight in your hands, you're going to want to pivot your feet. Pivot your feet first and then move your body. So you want to keep your body like it's in a pull, right down the middle, and move accordingly. So another issue that you're going to be encountering when moving a patient on the bed, and that is to keep your area clean around your feet and on the bed for the patient to be able to move freely, to allow unhindered movements and safety. This is for your feet as well. Any obstacles or liquids on the ground need to be moved and picked up, just in case if you need to move quickly to help a patient transfer in the bed. Next, we want to reposition the bed according to the therapist that's going to be in charge of any movement. So this is going to be lowering the bed rails, if we did have any bed rails, lowering any bed rails that might be in the way, moving any wires or tubes that might be connected to the patient to allow unhindered movement as well, along with adjusting the height of the bed to around your waist level and when you're in proper body mechanics stance. So that's, if you remember, bent knees, bent hips, straight back. So you're going to want to have the bed at your waist. This is pretty good right now, but I could do a little bit lower. Next, you're going to want to put one knee on the bed if the patient isn't in the position that is allowing you to do that movement, such as if the patient is too far or if the patient needs more assistance than you are able to give them when you are not on the bed with them. Next, we're going to be talking about positioning and moving the patient. First, you want to check the patient's weight. So you can either check that on the patient's chart, or you can kind of assess it visually to see if you're able to move the patient and assist the patient properly and safely. If you're not able to do this, please get another assistant to help you in the movement, or use any assistive devices that could help the movement as well, such as any overhead bars or any rails on the bed that could help the patient help you move him or her. Next, you're going to want to keep the patient to you as close as possible. Keep the patient close to you as possible gives a sense of security, as well as you're able to manipulate and move the patient whatever way you like to, without putting any risk and unwanted pressure on your lower back. Next, you're going to want to rather push the patient rather than pull. Pulling the patient by the arm could injure the patient's shoulder, could also injure the patient when you're pulling the leg by the hip, depending on where you pull the patient could hurt them in that joint. Also, another good thing is to push a patient is you're able to manipulate and utilize your weight easier rather than when you are pulling. Next, when you're rolling the patient, you're going to want to roll the patient towards you rather than away from you. Rolling towards you gives you more control, but also gives the patient more sense of security that you're going towards you just in case if they do slip and fall. If you're pushing away, they may roll and continue rolling off the bed, which is obviously not good for the patient or yourself. Next, you're going to want to stagger your feet. Staggering your feet throughout the movement will help you react to any unsudden movements that the patient may have, from jerking because they're unsure of the movement or they think they may be falling. So this keeps you on your toes throughout the movement. Next, you're going to want to try to avoid reaching over the patient. Reaching over the patient is okay in some parts if you're trying to move them, but you want to make sure that you're able to have support on yourself. If you're reaching over and you may be slipping or falling, and that could that could start an injury to the patient. So preventing reaching over prevents injury to the patient. Another general key details to moving a patient is you're going to want to try to complete the movement in one fluid motion. Completing the task in one fluid motion prevents from any jerking or any pulling that is not wanted during the movement. Next, you want to maintain good communication throughout the whole bed mobility task. Maintaining communication with the patient, with an assistant, with anyone in the room that's involved with the movement to keep everyone on the same page so there isn't any unexpected movements or jerking from the patient or from the clinician. Alrighty, next we're going to be working with the patient on moving the patient from supine, laying on their back, to side lying, depending on what side they want to go to. So as of right now, I'm going to have the patient go from supine to side lying on their right side. Okay? So first off, we're going to have to do is we're going to bring your knees up and place your feet flat on the bed. And your right knee up and flat on the bed. Alrighty? Since you're going to be rolling towards me, remember you want to roll towards you, not away, to give more sense of security, more control. Alrighty? So you're going to be rolling towards me. You're going to be wanting to bring the right arm up and across and over to the opposite shoulder. With the other arm, with their left arm that's going to be rolling towards me, you're going to bring it across and down to reach their opposite hips. Okay? This allows the patient's arms to stay out of the way when rolling, but also if you can notice, starting to engage them to roll over, with them reaching over. If the patient wants to help, they can by reaching over to the bed rail. Well, we don't have any bed rails right now, but they can reach over to the bed rail and help pull them as well. Okay? So right here, what we're going to do is we have the patient set up. You're going to put your left hand on their right shoulder and your right hand on the furthest knee, which is going to be their left knee. And then on a count of 3, you're going to want to look towards the way you're rolling. So you're going to roll towards me while I'm giving you cues to roll as well. Okay? You ready? 3, 2, and 1. Alrighty, there you go. And this ensures one solid log roll to keep the shoulders, mid-back, and the hips all intact into one. Okay? Go ahead and roll it back. There we go. Alrighty, and if you can show me. So go ahead and put your feet down and put them aside.
Alright. So go ahead and tell me what you need to do. I'm going to be raising her legs up so her knees are bent and her feet are flat on the bed. Correct. I'm now going to take her right arm. Or no. Right. Okay, her right arm, I'm going to put it on her shoulder. Correct. Now I'm going to take her left arm and put it on her hip. That way it gives us full movement here to be her, full opening here to be able to roll her. Correct. Now I'm going to take my left hand, put it on her right shoulder, and then my right hand, put it on her farthest most knee. And I'm going to count to 3. I'm going to have her look in the direction that she needs to roll, and we're going to roll. So look over. 1, 2, 3. We're going to roll. There you go. Perfect. Good job.
Now next we're going to be going over the proper technique of getting the patient from supine to side lying to sitting on the edge of bed. Alrighty? To do this, you're going to want to do what we already did with log rolling. Alrighty? So you're going to want to bring the legs up, place the feet flat. You're going to be rolling towards you, not away from you. So you're going to want to have to reach the farthest arm across and down to the opposite hip, and have the arm closest to you reach up and across over to the shoulders. Okay? Now before you start any movements, you want to get the patient's permission and inform them of what is going to be happening throughout this technique so they aren't alarmed by any sudden movements and might react in an inappropriate way and could hurt you or the patient in the process. Okay? So next we're going to bring the patient onto side lying. Okay? And as you remember, you're going to put your left arm on the furthest shoulder and your right hand on the furthest knee. And then count to 3 to get the patient and you on the same page. Alrighty? 3, 2, and 1. Alrighty. So now we have the patient on the sideline. Next, we're going to have to go to bring the patient from sideline to sitting. Okay? So what we're going to be doing is positioning the patient ready for success on moving to sitting. So you're going to bring the farthest arm, it's going to be her left shoulder, or her left shoulder, I'm sorry. And you're going to want to make a fist. Bring that fist and put it onto the bed like you're going to be punching it, okay? When I lift her, she's going to be assisting me with that arm by pushing down, okay? You hear that? So when I lift, you push down with that to help me, okay? Next, to properly move the patient, you're going to be wanting to bring the legs close to the edge of bed, and then we're going to be wanting to swing them down when we bring up the upper body, okay? So did you hear me? I'm going to swing your legs down and I'm going to be bringing you up. So don't be alarmed when your legs go down. When your legs do go down, remember you're going to be pushing with your arm to help me bring you up, right up. And we're going to be wanting to do this in one solid movement to keep her spine in one solid roll. As I said with you, with proper body mechanics, like a pulse going through you, from your head all the way down to your feet, same with the patient, from the head all the way down to the feet. So we're not going to want to move her upper body, okay? So to do so, you're going to want to place your left hand or your left arm underneath their left shoulder or their right shoulder and put your hand on their back of their shoulder blade while their head is resting on your forearm. Then with your right arm, you're going to want to bring it over and under their thighs to be able to swing the legs off the edge of the bed in the same motion of you bringing your left arm up at the same time. Okay? If the bed was a little bit lower, I'd bring her legs off a little bit further and rest her knees on my right leg, but unfortunately I'm not able to do that because of the bed positioning, okay? Alright, so when I move your legs down, I want you to push with this, okay? On the count of 3, we're going to move together. So we're going to go, alrighty? 3, 2, and 1. Alrighty, there you go, okay? And you're going to want to keep you directly in front of the patient at all times and keep a hand on their back until they're stabilized in this position for you to be able to walk away. If you move immediately after this and they're not set in their position, they could topple backwards, topple forwards, topple side to side. So you want to keep a contact guard on your patient at all times. Okay? How does that feel for you? Feel okay? Alrighty, so let's go ahead and go back into side lying and supine. Here we go. There we go, and to the side. There we go. All right, now if you can show me.
I'll be giving you verbal cues, you can give me help, but I'm going to try to do it by yourself, okay? So I'm going to be raising her knees up, so her feet are flat on the bed. There you go. I'm then going to take her left arm and rest it on her opposite hip. I'm going to take her right hand and rest it on her opposite shoulder. I'm then going to take my left hand and rest it on her farthest most shoulder. Correct. And my right hand on her farthest most knee. And I'm going to count to 3, and we're going to roll together. Okay? 1, 2, 3, and we're rolling. Good job. Now once we're this way, I'm going to take her upper arm, and I'm going to put it in front of her, and I'm going to ask her to make a fist. I'm then going to put my left arm underneath, so her head is resting on my forearm, and my hand is on her upper back. Good job. Advise her why she's putting her on my back. Okay. And your arm is going to be put into a fist on the side here so that you can help me lift yourself up when we start swinging you around the sit up. Okay? Then I'm going to put my right hand underneath her thighs. Inform her that the legs are going to be swinging off the bed. Okay. And then your legs, when I start to swing your legs off, or your legs are going to swing off, that's when I'm going to start the motion of having you sit up. Okay? So I'm going to count to 3, and we're going, and then as I lower your legs down, I'm going to lift you up, and you push with your fist and your arm to lift you up. So count to 3. 1, 2, 3. And I stand directly in front of her. Make sure that she's stabilized, that she's not moving back or forward or to the side, and we're done. Good job.
Next, we're going to be going over the proper bed mobility, moving the patient from sitting on the edge of bed to supine. All right, it's going to be very similar to getting the patient from supine to sitting on the edge of bed, but it's going to be in reverse and in one fluid motion like how it should be from when they're in side lying to sitting on the edge of bed. Okay? So first, since the patient is going to be going onto her right, we're going to want to bring her right arm up, over, and across to her opposite shoulder. And then with her left arm, we're going to put her hand into a fist and advise her to push onto the bed and to use it as an assist when lowering the patient onto the bed. Okay? Next, you're going to want to keep your wrist and hand onto her back shoulder blade, along with your right hand to reach over and under the crooks of the knees to help assist the legs on bringing them up and over and safely onto the bed while lowering her upper half onto the bed. Okay? So what we're going to do is when on the count of 3, we're going to lower you to your right. I'm going to bring up your legs, and you're going to be pushing down with your left arm to assist me on lowering you down safely. And when you get down to your back, go ahead and roll over onto your back. Okay? All right, here we go. So we got 3, 2, and 1. And roll. There we go. Perfect. Okay. And now if you can show me